Why the heck do you care about your hormones, and why should anyone else care about their hormones?
I've been dealing with autoimmune issues now for the last at least several years, certainly, but really now I'm recognizing, learning in the program, that this has been something that's been brewing for many, many years in my life. And there is such an important connection between
Mm,
hormones and autoimmunity. And it's something that no other doctors really are connecting the dots and helping people with. And I have been begging doctors, and I mean begging doctors for
yeah.
years and years to help me sort out what's going on with my hormones, because I know that they're part of what's fueling my autoimmunity, and they're not balanced. And I always got, well, they look great on your test results. Everything
Mhm.
looks normal, and you don't have these symptoms that are classic for this type of a hormone issue, and you don't have these symptoms, so everything must be fine. And that is so frustrating for somebody.
Yeah, your specific pattern, I call it hidden PCOS. That doesn't exist in the medical literature. No doctor's ever heard of it. It's called hidden PCOS. And it's hidden because nobody else could really see it. I didn't go into it with Anne's result, but we reviewed several hidden PCOS, and we went into the biochemistry of what hormones become what hormones. The reason she knew was hidden PCOS. I'm not going to get into the biochemistry of this, but the way certain hormones turn into testosterone. And if those source hormones are low, like at this point, this could be looks normal, but it's actually falsely normal. And I think about Anne, like 5 years ago, those precursor hormones are super high or normal, the testosterone would have been through the roof.
Yeah.
So it's literally something where people have to really understand how hormones are created, how they break down and everything, to really think, to be like, I'm not gonna be fooled by this normal result right here. Cause that looks technically normal on that testosterone. But it was completely screaming, oh my gosh, she's been PCOS her whole life. And it's now her precursors are so low and plummeted because she's been going through adrenal fatigue for quite some time that it looks normal. And then all of a
Exactly.
sudden, like, you don't have a problem. You just cuckoo for Cocoa Puffs. Let's put you on some antidepressants there, you little lady. You don't have a fertility problem. It's nothing to do with your hormones. Let's put you on IVF for 20,000 around or whatever. Like, this is what we do when the doctors themselves don't understand how hormones are made, broken down, how the different types of patterns, and how depending on the stages of life you in, and depending whether you have autoimmune disease or not, it can be hidden. And you
Right.
have to actually really know your science to be able to say, "That's hidden, and I know it's there."
And that's the thing. It's hidden to
Mhm.
almost everybody, including medical doctors,
Correct.
including doctors who specialize in hormones and fertility that I've also seen. I've seen many of them. I've been flown all over the country to try to visit different IVF clinics. Nobody could uncover this. My functional doctor could not uncover this. And so it's really a credit to you in that not only can you spot it immediately, but I'm proud of myself too, because I was able to spot it. You did actually teach us to think like you. You know what I mean? You explained this in such a way throughout the program and just throughout the hormone week that once I got my results, I said, oh my gosh, I
You
had
figured it out,
I had
Erin.
I had hidden PCOS this whole time. And you taught us that. And so you gave us that education that is just invaluable. I mean, it really is. So that I was able to diagnose what doctors have not been able to diagnose previously because of you.
So, for me, like, this is like multifold. A lot of people be like, "Oh, they're talking about fertility, then it doesn't matter. Hormones only matters if it's a fertility." But
No.
I have something really important to say about Anne's case and everybody else's case. Why is it important to know she's PCOS now? She's no longer trying to get pregnant. So why is it so important still? Every single pattern is really important. I don't care if it's PCOS, estrogen dominance, however many other patterns we teach in here, is that it has a dramatic impact on autoimmunity. And I'm going to use PCOS as just an example here. Do you know that PCOS, polycystic ovarian syndrome, 90% of times is missed by your doctor?
Mhm.
But do you know that, in my opinion, it's an autoimmune disease? And it's not just my opinion, and here's why. Polycystic ovarian syndrome is frequently pre-diabetes that turns into diabetes. The risk of the person with PCOS turning into diabetes is crazy ass high. Diabetes is an autoimmune disease. So what the hell is PCOS?
Is yeah.
An autoimmune disease.
Right. And it's so
right?
true. It's so true because I have blood sugar problems. I have type 1 diabetes that runs in my family. You can't make this stuff up.
Well, and here's the thing. Once she realizes that she's PCOS, polycystic ovarian syndrome, you heard me say it in the video, but I'm going to say it again. Her linchpin to literally solving any autoimmune issue she has and some of the symptoms and diagnosis, because I think you had blood work for scleroderma, correct?
Yes.
And she's sitting here scared to hell, like not have the symptoms, but blood work for scleroderma. And she's wondering what the hell's going to happen with that. Right.
Yeah.
And
Oh,
here's what I'm going to tell you on your watch and my watch, you're never the hell going to get it. And you know why? I just told you the biggest linchpin to your autoimmune issues is that damn blood sugar that's made worse because of the autoimmune issue related PCOS. So her blood sugar goes really high, stays there, and then it plummets super fast all the time. And you
mhm.
guys know from the 5 pillars, that's one of the biggest trigger of autoimmune disease. Specifically for her, it's even more. So it's literally critical and life changing and autoimmune altering for her to realize that is my biggest issue. Here are the symptoms that are relating with it. And here's the things that I can do about it. And like there's a tangible result, which is not just I'm immediately going to be, I'm sleeping better, my anxiety is less tonight. Is literally like, does she have to get scleroderma just because she has a blood test that's positive with no symptoms right now? Is that inevitable? Is that completely inevitable? Like one of those things that where it's just like, oh, I got the blood test positive, and so now for sure I'm doomed for the rest of my life, and I'm going to get worse and worse and worse and worse. This is what we think of every autoimmune diagnosis, and I call bullshit. I call bullshit. She could have a blood test that's positive, and on my watch and her watch, and you guys in the audience, I hope she never, and I don't hope, she won't be getting scleroderma on my watch or her watch because we know what the hell's feeding it.
Well, and that's the difference too. I speak to my rheumatologist and other doctors, and they tell me, "Oh, there's nothing really you can do except take, certain medications to try to maybe help with symptoms, but
Mm.
you're going to get what you're going to get, and there's no intervention that can be done." And it is so refreshing to hear you, and not just dream about these things, but you have the proof for it to say, no, we can intervene. If we attack your root cause, we're going to stop the autoimmune attack in your body, and we're not going to let it ever progress to that point. We know that our hormones are playing a key role
Yeah.
in autoimmunity, so it absolutely matters.
But I also to using PCOS as an example that people don't even consider autoimmune and miss all the time, I I tied it in even further. So because of those high blood sugars, right, the staying there and they plummet to low. High low is still a big swing, but they people with PCOS stay high for a long time, and the higher period of time they spend high crosses the blood brain barrier, which is why people with PCOS have more brain fog, depression, anxiety, irritability, mood swings, more diagnosis of ADD, ADHD, more family history of dementia.
Yeah.
All right. So this isn't just like, some blood sugar thing. PCOS, what's the fertility? It's like literally this has to do with your freaking brain. And not that you're doomed. Like, here's how you fix the root cause of the problem. Here's what you can do to turbocharge this. Take Pro Omega 1001 in the morning, 2 at night. Why? Omega 3s crossing that blood brain barrier is so protective for every single brain cell there, right? So, this is why people with PCOS have more PMS, depression, anxiety, brain fog, dementia, you name it, all this stuff. There's a biological reason for why that's happening, not because you're cuckoo for Cocoa Puffs or that you're weak.
Right. No, I can absolutely relate to I've got the anxiety, and my brain fog has been so bad at times that, you can't think straight. And I'm a TV news anchor, as some of you might know, and I can't have brain fog when I'm on live TV. I need to be on, just as all of us do. We can't be dealing with this. And so if
Right.
there is a way to combat it and turn it around and think clearly and become ourselves again, who wouldn't want that?
I'm gonna just ask people in the audience right here, right now in the comments section. I'm gonna need you to write something because I'm gonna ask you a question. And all of you that are watching, every single person watching right now, type in chat what are some of the hormone symptoms you have and what autoimmune struggles you have.
And for people who are wondering, okay, well, what are some of my hormone symptoms? Offhand, you've got weight gain could be a hormone symptom,
We actually
right?
have a whole hormone checklist guide. If you want the hormone checklist guide to know which symptoms you have are linked with actually hormone disturbances, to put in the chat right now, type in hormone checklist, but tell me what symptoms you're struggling with. Then check your Facebook message request later, and we will get a hormone checklist to you. There's also a link we're going to put in chat. You can send a message directly to our team so we can get the checklist to you. We can see what your hormone symptoms or autoimmune struggles are. We can get the exact right resources and trainings to you. Thanks, everybody.